Lovely. Thank you very much, Emily, and lovely to see so many people here today. Right, so the what we're going to talk about today is delivering a net zero NHS, talk a little bit about Imperial College Healthcare NHS Trust's green plan and some of the things that we're doing to try to achieve net zero over the next 25 years. But before I start, I wonder if people could have a little look at this, and we'll return to it towards the end of the presentation. One of the key things that we will be looking to explore as we implement our green plan is how do we involve our patients and how do we involve our communities. So I wonder if people could just have a little think about how we can best work with patients and our local communities to put our organisation on a path to a cleaner, greener, healthier, and more equitable future. So if anybody has any thoughts around that or any ideas, please do put them in the chat, and we can hopefully hear them a little bit later on and explore ways in which we can work with our local communities and our patients to achieve this shared goal. So we're a trust based on 5 sites. We have around 14,000 staff, and we care for well over 1 million patients every single year. We have a rich heritage and we have an ambitious vision for what we can deliver to our patients and our local communities. But we also know that the NHS contributes to around 5% of the UK's carbon emissions and probably around 3.5% of road travel in England. And when we look at our carbon footprint, we really recognise, and perhaps for the first time really over the last year or so, we recognise that in caring for our local communities, we emit a lot of carbon, or we use things that are associated with carbon. And you know what this kind of shows is that every single day we're probably emitting around 100 tons of carbon every single day, just from our heating, cooling, lighting, and operating our equipment. And you can obviously see the size of a ton of carbon there next to a person. And then when you add on to that, things that are included in our supply chain, our pharmaceuticals, medical devices, patient travel, staff travel, the carbon footprint of our trust is significantly higher. And we're aware of the impact that climate change and poor air quality has on health, well-being, and inequalities. Every day there is more evidence showing that climate change, poor air, and the detrimental impact on health, people's well-being, and that it widens healthcare inequalities. We are aware that global temperatures have risen by 1 degree, and we're on track for potentially 4 degrees of warming in the 21st century. And we recognise that climate change and poor air is a threat to human health. And that's the reason that Imperial are proud to be acting in ways to reduce our impact on health, well-being, and to hopefully have that impact on reducing inequalities. So the question, why now? In October 2020, the NHS committed to becoming the first healthcare system in the world to be net zero by 2045. And they published Delivering a Net Zero, which was well received by the climate change community and within the NHS. And you can sometimes ask, you know, well, why now? And despite the kind of profound impact that the world has had because of COVID, what this particular commitment really kind of underlined is that it was quite unapologetic in pushing for progress in this agenda, even though health services are still confronting the impacts of the pandemic. There are some things that the pandemic have helped to accelerate that can help us reduce our carbon emissions, things like virtual outpatient appointments and more digitization. Equally, there are other things that are working in the other direction, use of single-use, increased use of single-use plastics. But it feels that the time is right to make sure that the NHS is fully on board with really tackling its impact on the environment. So I'm incredibly familiar with this diagram. I see it pretty much all the time. I'm not sure how many of you are familiar with this diagram, but really what this diagram is showing is that the NHS is tasked with acting on its emissions that it both controls, so those that are under its direct control, and those that it influences. And around 25% of the carbon footprint of an NHS organisation is related to things that it can directly control. And around 75% are things that it can actually influence. So, for example, when we think about things that we can actually control, we as a trust need to act to decarbonize our building energy. And, for example, reduce use of more harmful anesthetic gases and more harmful inhalers. Those are things that we can control directly. And in terms of things that we can influence, we need to work with suppliers, we need to have partnerships and work with our local communities. There was a recent NHS procurement roadmap which has an ambition to not purchase from any suppliers that do not have an equal commitment to net zero and can demonstrate their progress towards net zero by 2030. That's something that we need to use our purchasing power. We need to use our soft intelligence to work with suppliers and work with providers to make sure they understand what the commitments are, they can adapt and they can decarbonize their processes and what they do, which feeds into what we do in terms of delivering healthcare. So when you look at this particular diagram, and I won't go into masses of detail, you can see it's incredibly broad in terms of the areas or scopes of emissions that the NHS needs to be acting on. And again, those that we're controlling and those that we can influence. So very broad, and our green plan looks to cover and move forward on all of these areas as quickly as we possibly can. And we're incredibly proud that earlier this year in May, we launched our first green plan. That's a full year before it's a mandatory requirement for all NHS providers. And we have our vision here. Our vision of our green plan is our commitment to reduce our impact on the environment, to deliver sustainable healthcare and helping to secure better health for life for generations to come. And underneath that is our kind of commitment to make sure that we're working with patients, staff, local communities and partners to make sure that we're on that right trajectory. And this is something that really always kind of like inspires me. When we had an opportunity last year in the NHS all staff survey to ask a couple of questions to our staff about what they felt around environmental sustainability and reducing our impact on the environment. And as I said earlier, we're an organisation of 14,000. I think over 6,000 people responded. And what we found was that 73% of our staff felt that we should prioritise ways of working that support the environment. And 47% felt that we make it easy to work in ways that support the environment. So what we really need to do is to keep moving up on both of those figures so that more and more people want to prioritise ways of working that support the environment, and we're making it as easy as possible. And I think what's really interesting about this particular figure is that whilst almost whilst almost 75% of our staff want to prioritise ways of working that support the environment, it's really important to remember that a lot of our staff will also be residents of the borough. So hopefully we can start building the kinds of networks and connections and the kind of broader agenda around reducing our impact on the environment as staff, as an organisation, as residents, as patients. We're all of those things, and how can we work together to make sure that we're all acting in ways that can support the environment better. So as I said, we launched our green plan back in May, and our green plan really is at the heart of it is around trying to inspire, enable and empower all of our staff to take action. And we've built our green plan around these sort of 12 green plan goals, which you can see there. And what we hope is that this will allow staff to identify areas that they're passionate about, identify areas that they're interested in, and hopefully galvanize all to act and to act now. And the key part of our green plan isn't just setting targets. Of course, there are targets there, and of course, there are trajectories around progress there. But what we want to really do is to base our green plan and try and create a culture and environment that is around continuous learning and energy and tapping into people's intrinsic motivation to really help one another to progress various different kind of initiatives that can really help reduce the impact that we have when we are delivering high quality healthcare on the environment. And I just discovered this quote the other day. I think it's a fantastic quote by Dr. Nick Watts, who is the NHS's Chief Sustainability Officer. And I think it really highlights the kind of pragmatic balance around action and priorities, and what we're going to try to do as a trust, and what all of us as individuals can do around reducing our impact on the environment. And I'll just sort of read it out to you because it really resonates. The key point is not to wait for the perfect intervention to emerge for you to take on net zero. It's time to go hard and go everywhere. Pick one thing you're going to wake up tomorrow morning and do. Then pick the next action on the next day and keep going. And this is exactly how I feel every day coming into work. What are we going to do today? What are we going to do now? And actually, you know, I'm going to talk a little bit about some of the progress we've actually made in reducing our emissions. And that's our kind of approach to our green plan. Where are the energy? Where is the opportunity? We know where we need to get to. There's a huge amount to do. Let's pick something and let's try and do that incredibly well, and show that we've had an impact in terms of reducing our impact on the environment, and then pick something else and let's go where the energy is. So really love that particular quote, and it kind of really inspires me every day when I come into work, and I'm sure that Gareth and other colleagues at the Trust may feel the same way around that. So let's talk a little bit about some of the progress that we've made as a trust. So between 2007-8 and 2020-21, our carbon footprint from our energy use has fallen by around 30%. And we have recently secured a grant which will be used for a range of energy efficiency projects, including the installation of an air source heat pump at Charing Cross. And the combined impact of these energy efficiency projects and the air source heat pump will lead to around a 15% reduction in our energy related carbon emissions across Charing Cross and Hammersmith hospitals. And we anticipate that these benefits will start being realised from next March as some of these works complete. So really great progress around decarbonising our heat and really becoming more effective and efficient around our energy use. There's lots and lots of other things that we're doing, and we're trying to weave a green thread across everything that we do. So in terms of new models of care, things such as virtual consultations, bringing care closer to home. So for example, dialysis at home, remote and agile working of staff, and redevelopment of our estate. These are all things that can have a significant impact on reducing our carbon footprint and reducing travel and movement of people and things, which can have a direct impact on our environment and in reducing air pollution. So lots going on, and lots of things going on which are happening in other trusts, and a lot of these things have been prompted by COVID, and it's going to be really important that we learn from the things that have worked really well and really embed these for a future in terms of delivery of healthcare that reduces or minimises the environmental impact of delivering that care. But also there's lots of local improvements and local initiatives. So at the clinical level, by trying to raise awareness of this and actually recognise that there is a lot of embedded carbon in clinical pathways, and a lot of the individual decisions that are taken by individuals delivering high quality healthcare have associated carbon impacts. So really trying to get staff to think about what are they doing clinically, and how can they make a contribution at a local level, and how can they reduce their environmental impact and make improvements that are safe. So here are just some examples that we can share with you. And again, these are local improvement projects that have a positive impact on the environment. And if you took some of these projects and you scaled them up across the NHS, you'd see much greater impact. So we have been, I'll pick a few examples. The top examples, we have been trialling the use of sterile reusable gowns in theatres. You're finding there that staff are very enthusiastic. They have very positive response to that. And just an 8-week trial, when you look at some of the data, it potentially suggests perhaps a ton of carbon emission savings relative to using the single-use gowns. So this is something that is being trialled in a number of other areas, and we would really hope to see if we can push that through on a larger scale across the trust, and also hopefully see other trusts doing things like that. Another good example is around endoscopy biopsy processing. We've got fantastic colleagues that are looking at that again to see whether they can reduce the amount of plastic being used in there, and they have some results at the moment that are looking quite positive. They are revisiting that, and they're going to be writing that up. But again, there is a potential there of restructuring how they do the biopsy processing, which can lead to a significant reduction in the use of plastic. So again, a local initiative that, if it was scaled up across the NHS, could really have a positive impact. And finally, something that we're doing at the Trust, which we're really excited about, is we are having a refresh of our ward accreditation programme. And we've managed to embed a small number of green plan metrics in there. So we are piloting those at a local level, so that we hope that we can raise awareness of our green plan, raise awareness of some of the issues that can, or some of the kind of behaviours that can actually have a very positive impact on reducing our environmental impact. And by having this in the ward accreditation programme, we hope that this can scale up across the organisation really quite rapidly through that particular programme. So that's something really exciting, and I'm really excited about how we can support wards to then make improvements based on whatever the status is of their accreditation. And finally, there's a huge step change opportunity with redevelopment of our St Mary's sites. Touched on this ever so slightly, but we've submitted our strategic outline case for redevelopment of St Mary's. And, you know, we believe that a redeveloped St Mary's would represent a huge step change in our reduction of the impact of our carbon emissions. This is through having a modern estate and using innovative logistics and facilities operations, and we're feeding into those conversations all the time to make sure that redevelopment really does consider the environmental impact of redevelopment, and there are supposed to be guidelines coming out which will help us to build our new site using net zero standards. So really exciting to be able to have such a wonderful step change opportunity in the pipeline. So I touched on this ever so slightly earlier. You know, addressing climate change is a complex problem. There are certain things that we can do that are within our control, but a large part of our carbon footprint is in spaces where we need to work with others and we need to try to influence others. So we're looking, this diagram kind of just summarizes all the different ways in which we will be exploring how we can partner, work together, really just to maximize the leverage and impact that we all can have around ways in which we can reduce our environmental impact and improve air quality. So one of those, as I mentioned at the beginning, is around trying to involve our patients and our communities more. But we're also looking to inform national policy, so things like local initiatives that I talked about that we can show are having an impact, and we're embedding them in the trust. We want to feed that up to national levels so that they can share that with other organisations, so they can adopt these new practices quite quickly. I mentioned earlier, we're going to have to influence supply chain decarbonisation and work with local suppliers to ensure that they have a clear understanding of the direction of travel and what they may or may not need to do to continue to supply the NHS. We're going to support and work with local authorities and their environmental plans. You know, we're delighted to be speaking today as part of Hammersmith and Fulham's Climate Change Carnival. So these are the kind of opportunities that we're really keen to explore. And we also had colleagues from Hammersmith and Fulham do a really fantastic webinar session on the impact of fuel poverty and how our staff at our trust can really play a role in signposting patients to resources and support that can help tackle fuel poverty. So trying to build that kind of support, those kind of partnerships there. So this is some of the stuff that we're going to have to do, but I'd really like to go back to this particular question around how best can we work with patients and our local communities to essentially get to our shared vision and goal around having a net zero organisation, in our case by 2045. So I wonder whether, Emily, there are any thoughts or reflections on this that people have put in the chat?
No, I think that's a question maybe I can post that question in the chat and we can keep coming back to that, Darshan, because yeah, would be really grateful if anyone has any ideas or would like to share ideas and answers to this question, because I think it's a similar challenge for us, Darshan, as you know, at the council, that we've declared that we want to get to net zero by 2030 across the borough. But we absolutely, you know, with the majority of emissions, I just mentioned before, I love that you're saying rather than out of our direct control, the majority of those emissions we can influence from organizations and from residents. It's the same question from us really. What are the ways of working? How can we work collaboratively, and how can we put people at the center of this transition?
Absolutely, and you know, our green plan really is about putting people at the center, and that's, you know, starts with our staff, but our patients, our local communities, and partnerships. You know, we recognize that this is something that we all need to act on, so it would be great to get some thoughts around that a little bit later on. So just very briefly, so I hope that that's given a really kind of clear idea about what the NHS's commitment to delivering a net zero health system is. I hope you've got some understanding around our green plan and what we're hoping to build in terms of culture and action, and a clearer idea about some of the progress that we've made and some of the progress that we hope to make. In terms of the implementation of our green plan, some immediate priorities that we have. We're looking to build a future-proof green plan infrastructure at the Trust. So we are we are improving our understanding of our carbon footprint and getting much more granular information around that, and we'll continue to do that. We also have mandatory reporting that we have to do as an NHS Trust. So we are doing that and feeding that to the national team so that we can really help understand what the carbon footprint across the ICS is and how we are progressing towards net zero as not only a Trust, but as an ICS. We are looking to launch or support a green network within the Trust, and we're hoping to launch that early in the new year and get some lay partners involved in our green plan implementation. And I think our aspiration as we move forwards with our green network is to really see where it takes us, where the opportunities are, where it is working well, and hopefully be able to expand that green network out beyond just staff. That would be certainly something that we'd look to aspire to do. And I think the reason we feel kind of that's a bit of potential goes back to what I said a little bit earlier, which is that a great many of our staff are going to be residents of Hammersmith and Fulham. And if we can kind of like get people to be really, really active in this space as residents, as patients, as staff, you know, we really might get maximum impact as fast as we can. At the Trust, we're building our education improvement, and big rooms is a term around how we go about delivering improvements so that staff feel that they are aware and can act to make the kind of changes that can lead to improvements, and can demonstrate that through using improvement method and measures to show that they are having a positive impact. Because from some of these really small ideas that are tested locally, we can then try to start building the case to say, well, look, you know, it's working here. Should we think about doing this across the entire organisation? Going back to the reusable gowns, the sterile reusable gowns, that certainly is an aspiration that we would have to significantly shift towards reusable gowns. And by having the education and the kind of improvement approaches, we can build the case to say, you know, we really should be thinking about doing this. We're baselining priorities set by NHS England. There are a number of priorities in delivering a net zero NHS that we need to respond to, and we are getting our baseline data and looking to act upon those. But going back to Dr. Watts's quote, you know, some of this is about trying to work collaboratively and opportunistically with staff where there is passion. So yes, within the NHS England priorities is a massive push to reduce anaesthetic gases, and we have a fantastic green anaesthesia group that is really keen to do this. So we are just pushing ahead with something like that really fast. We are recognizing that staff are really interested in recycling and waste, so we want to try to co-produce with staff a better waste management offer, so staff know what to do, understand their impact, and, you know, can really mobilize locally to take some action around things like recycling and waste. So where there's the energy, we want to put some support and try to encourage our staff to really move that forward. Again, we're going to be looking to leverage our purchasing power and our anchors and social value mission as a trust. So looking at upcoming procurements and upcoming kind of purchases and trying to start building, and it will take time, but trying to build that kind of capability, so as a trust we can really explore with suppliers what are they doing to decarbonize their organizations, how we can then work with them to support them and to really understand that this is an organization that truly is decarbonizing how it operates, and therefore as a trust we want to work with them and we want to develop close relationships as a trust and a supplier there. Obviously raising awareness within the organization, but equally raising awareness outside of the organization. And, you know, again, delighted to be talking to you all today about what we're doing at the trust, and then building partnerships and looking to pilot innovations. So those are the kind of key immediate priorities. Probably sounds a little bit NHSy, I apologize for that, but hopefully some of the other examples I gave you earlier on felt a little bit more tangible there. So I think that was the last of what I was going to say. I had already always planned for around 30 minutes. I'd be delighted to hear reflections and thoughts, potentially take some questions if that's helpful.
Amazing. Thank you, Darshan. I mean, an incredible program and a really ambitious green plan. And I think that there's lots of bits in that that are really adaptable and flexible to other organizations as well, which is exciting. And yeah, as you know, really keen to collaborate where we can as the council. But thank you very much for presenting today. Thanks for that, everyone. So finally, just before we wrap up, what is on today? If you have a look at the programme, which is on lbhf.gov.uk/climate-carnival, you can have a look at some of the events that are happening today. We've usually got a couple of webinars in the afternoon and lots of events happening out and about all over the borough. So please do have a look. We've got over 50 things happening this week. So please do check out the programme and get involved if you have time later today. And finally, just before we wrap up, please do sign up to our newsletter. So this is a monthly newsletter all about climate action taking place across the borough. We talk about what we're doing as a council, things that are happening in the community, things you can get involved in, as well as what we're reading and sharing. So if you head to the climate pages on our website, you can sign up for Climate Connects. And finally, that's us for this morning. So thank you very much, everyone, for coming along, to all of our speakers for presenting and for everyone's questions and comments. That's our generic email address there that comes through to me. So look forward to speaking with you there, and our web address as well. Thanks, everyone, and enjoy the rest of the week.